My name's Catherine, I'm from Arcadia Physiotherapy, and today I want to talk to you about my favourite rehab item. The tennis ball, as I'm sure you're all familiar with. This can be used for so many different things and it's really, really effective. So I'm just going to teach you a couple of ideas that might help you with any niggles you've currently got. And that's basically using it for self-massage. So these cost about £1, probably less. They do come in different firmnesses, so you want a fairly firm one that's not going to kind of squish under your own weight. And what I'm going to show you is some different self-massage techniques. So the first one is for people who have tight glutes. And often you get sciatic symptoms that come down the back of your leg, tingling, burning sensation, and that can be because of muscles getting tight in your bum. So get yourself on all fours like this. Take your tennis ball and simply pop it into the squishy bit of your buttock. Okay? What you can then do is using your knees and feet and your hands, just push yourself in a rocking motion backwards and forwards. And pretty soon you'll find some knots in there. You can wiggle side to side. Just find your way around in that soft tissue mass in that buttock and you'll find some knots. Once you get one, try and just do smaller little rollings over it, basically like massage thumbs, and use your body weight to press down on the ball to get that real depth of pressure. If you want to add to that, you can take that leg off, and again that takes the pressure down onto that hip, just using 2 or 3 limbs to push you along. You can also change the angle, you can roll it around, and so on. So that's the one for the glutes. Another one that's really useful is if you get knee pain, often from running. It's called runner's syndrome or runner's knee, if the IT band or other structures around the knee are pulling the kneecap out of its tracking alignment. Always get assessed, obviously, but if you have been assessed and the muscular knots around here is the problem, and this is again really, really useful for just chipping away at that problem and that niggle to make sure that you're maintaining your rehab rather than just relying on a session every week. It's about the in-between stuff that's really important. So, again, get yourself supported on your other limbs. So the limb that you're working on does have to be as little work as possible. So what I've done here, my knot's around here, and I can almost feel it when I press on it, that ache coming into my knee. So I know I'm on the right knot because it's clear that those two have an association, I can feel it. So again, take my weight on my other limbs, using them to push me up and down. This leg is pretty relaxed. I'm just using the weight of that leg to press down on the ball. And it can be quite tender, but once you find the knot, again, it's worth doing little rolls over, again and again, just kneading away. Okay, and again, I can just feel that in my knee, because physios get problems too, but it really has got beneficial effect. Okay. Final place to work on is often people get knots in their calves. Same principle. Let this leg relax and the weight of it press down on the ball, and just use your other arms and legs to roll and find those knots as you go all the way up and all the way down. In terms of how often you might do this, it depends on how hard you want to go at it. I would probably say about 5 minutes a day. If you feel like on the following day it's really tender and it's really bruised, then you might have gone too far at it, or your body might be just protesting a bit, so have a day off, but try to get into a regular routine. If you ever get bruising on the skin, then you really are getting too much. We don't want to damage tissue, we want to start just massaging you gently to release it, and using your own body weight is a very natural way to do that because your body's working on its own pressures rather than somebody else's elbow doing the job. Okay? So as I say, it's a brilliant tool, it's very cheap and effective, it's accessible to everybody, and so do get yourself one, but always get yourself assessed first by a physiotherapist to make sure you're addressing the right problem. Thanks very much.